I get really bad tachycardia, dizzy spells. There's no history of heart conditions in my family.
My doctors were not able to get my blood pressure under control.
I was coming home really tired, and even just walking around the house, I was just finding that I was extremely winded, couldn't catch my breath. That's very atypical for me.
Women excuse our symptoms. You know, we say we're tired, we're fatigued because we're so busy. We excuse maybe a muscle pain for something we did. We probably pulled a muscle or something.
I just would give out of breath, start hurting right in here. And I knew I had a problem because I'd had it for a while, and it didn't get any better.
You could just all of a sudden have a problem one day and not realize the little nuances and differences that led up to that major catastrophic problem.
Misdiagnosis in women is not uncommon because we suffer from conditions that present differently than what will they be in a man, which is what we understand in our medical literature. So we tend to be more misdiagnosed than men, which makes sense.
Welcome to episode 2 of Treat Me Like a Woman. I'm Megan Clementi. All of these women suffered a form of heart disease. However, they did not show to their doctor's office complaining of what medicine calls typical symptoms. Instead, they experienced shortness of breath, lower chest discomfort, and fatigue, symptoms not necessarily associated with a heart attack or heart disease in women. They were misdiagnosed or dismissed until they found a cardiologist who listened, a woman who understood that their symptoms were atypical to a man's. Dr. Nitza Alvarez, a board-certified cardiologist, is working to bring her message to every woman in our community with the hopes that this will become the standard of care in our country and the world.
There was a moment in history that with the interest of, and I like to say, quote unquote, protecting the women, they were not included in research. They were concerned about what the hormones in women could do, and they will skew the results. So they were in the interest of not skewing results, then they decided to exclude them. And a big population of women, like pregnant women, for example, were not included either in researches with the interest of protecting the child.
I have a daughter who lives here in Orlando, and the other daughter is in Pennsylvania. The one in Orlando, I gave her the book, and she calls me up one night. She says, "Mom, I'm having chest pains." I said, "And what does the book say, my love?" He says, "Go to the ER." "Then go to the ER or call 911 now." They said, "Oh, it's probably gas." But she said, "No, let's check this all out."
I was coming home really tired, and even just walking around the house, I was just finding that I was extremely winded, couldn't catch my breath. That's very atypical for me. Had never experienced any symptoms like that. So it was definitely cause for concern. And Dr. Alvarez came highly recommended, so that's why I gave her a call.
I just would give out of breath, start hurting right in here. And I knew I had a problem because I'd had it for a while, and it didn't get any better, so I thought it's time to do something.
We need randomized trials, and so that takes time. So we start with observational data, and then we said, okay, so we realize that there's a difference. So then what is the difference? So then that takes decades to understand what is the difference. And then as that starts getting into mainstream, then we have more and more providers. And my hope is that future generations, when they come out to practice their cardiology, there's already a gender identification right there, understanding that who do I have in front of me, and instead of just putting one stamp into that person.
Getting a doctor who will listen can be tough. And when we're young, we think, oh, that couldn't possibly happen to me. I'm too young. But of course, as some of these women's stories have shown us, age is just a number, and heart problems can happen to anyone, whether they're 75, 45, or even 25.
Of course, when you're young, normally we are healthy because that's the blessing that we have from our Creator. But if we stop thinking about heart disease having a certain age that you have to worry, then it will be much easier to capture those patients at younger life that might have a problem. When we see younger patients with cardiac problems, they tend to go provider after provider after provider because nobody can conceive that they actually have something. They tend to be dismissed more. And young females will normally present with symptoms that are not very, very specific, so it makes it a little harder to know what is happening with them. And so hence the tendency to think that they're anxious, or the tendency to think that they just to worry about things.
There's no history of heart conditions in my family. So being younger, I just chalked it up to being nothing because I was always told it was just anxiety or nothing. After running some tests, I have a condition called POTS. I get really bad tachycardia, dizzy spells. But she had me change some lifestyle changes, actually, and it's helped with some correct medication.
You know, with Dr. Alvarez, I went in there in tears because of my daughter. She has cancer right now, so it's a difficult thing. She's only 40 and has 2 little kids, and it's tough. I was having heart pains, but it was angina because of what I was going through.
The gap in healthcare for men and women is large because we're not little men. Our genetic makeup is different, and the way we treat our health conditions, like heart disease, should be different from the way a man treats his. This gap in healthcare is finally becoming a talking point among many, even reaching the congressional level.
This issue has become so critical in our society and so important that have reached congressional level, where we have senators working into passing bills that are all related to women's health and trying to make it be part of our day-to-day, where providers need to be certified or take certain credits that are specifically related to women's heart disease and the differences in the treatment. And so with all these different approaches and more people like me and more doctors that are interested in this topic, we hope that that gap can finally close and that we can all deliver excellent care for our women.
In June of 2023, U.S. Representative Amelia Strong Sykes, the co-vice chair of the Bipartisan Women's Caucus, was joined by co-chairs Representatives Kat Kamak and Susie Lee, along with co-vice chair Representative Monica De La Cruz, as they led a bipartisan letter to the U.S. Health and Human Services Secretary Xavier Becerra, requesting that women's cardiovascular health be a priority. The letter has also been endorsed by the American Heart Association. The letter states that the widespread lack of CVD awareness and subsequent lack of screening, diagnosis, and treatment only broaden the impact that this disease has on women. Women's awareness of CVD has declined by approximately 20% in the last decade, most significantly among younger women. And congressional support for cardiovascular health doesn't stop there. Congresswoman Mickey Sherrill, who represents the 11th District of New Jersey, introduced H.R. 880, Heart Health Enhancement Through Access to Research and Training Act bill, to Congress. This bill authorizes grants to continue educational programs for physicians in order to prevent, identify, and treat cardiovascular disease in women. This will help healthcare providers receive specialized training to enhance the health outcomes for women suffering from or at risk of developing heart disease. The gender gap, that definitive gap in healthcare between what a man receives and what a woman receives, has been a large part of Dr. Alvarez's mission, educating women so they can be their own healthcare advocate. We recently tested women's knowledge of heart health. Some of these statistics might very well surprise you.
What do you think is the number one cause of death for women in our country every year?
I would say breast cancer.
What would you guess to be the number one killer of women when it comes to diseases in America?
Cancer. Unfortunately, I would say breast cancer.
That's gonna be heart attack and then diabetes.
I would say heart.
High five to you. And knowing that, how many women do you think die of heart disease each year?
Oh, a lot. So it's 250,000. Oh my goodness, that's a tough one. Probably between maybe 8,000 to 10,000 women per year. Is that high? Oh,
More.
oh my gosh, that's frightening. Really?
Can you guess a bigger number?
Are we 100,000 up to that?
More.
Oh my gosh.
Over 300,000 women
Oh
die
my
every
gosh.
single year of heart-related
That's frightening.
diseases.
I knew it was a lot, but I didn't think it was that much.
What was the most eye-opening thing that you learned just in this short little gathering right now?
Knowing that the biggest cause for women's death is heart disease, I always thought it was either breast cancer or ovarian cancer or something of that nature.
That it is 75% preventable.
That women they don't have the same diagnosis as a man.
The statistics are shocking, aren't they? We know that heart disease is the number one killer of women, and Dr. Alvarez is one of the pioneers striving to raise awareness of heart disease in women, our differences in risk factors, and presentations.
I'm inviting more women to just speak up, and we can do that in so many ways. The speaking up means just seek for more understanding. And I think that the movement in our society these days is more to speak up, to seek to understand, and not necessarily just in medicine. I feel that in our society in general, there's more material for people to read. We live in an era that information is not an issue.
The gap is not just in recognition, diagnosis, and treatment for heart disease in women. The gap is in service. In 2021, the Association of American Medical Colleges predicted a shortage of 120,000 cardiologists by the year 2030. Health insurance is also a problem. More than 7 million Americans suffering from cardiovascular disease are currently uninsured. However, even for the millions of Americans who do have insurance, preventative care is not covered. We live in a world of reactive medicine in which we treat a condition once it manifests instead of working to prevent the problem from occurring to begin with or detecting it early before it can cost lives. Only recently have we started to hear about gender-specific cardiology training. Even with the cardiologists that are serving the women in the community, there's a gap in knowledge as they did not receive specialized training for the management of cardiovascular disease in women. And it is only if they're interested in learning it that they can get up to date in our differences.
There was an article that was published in a medical journal that says that if a male provider is surrounded or practiced with female providers, they're going to be more prone to be sensitive to the differences in gender when it comes to a woman presenting with a heart problem. So that tells you that it's not necessarily a lack of caring. It's perhaps a lack of awareness, but it's our responsibility to make sure that we are up to date on that data, because we are all going to be encountering those individuals in our path. If you have an apple in front of you and you don't know how an apple looks like, then you don't know that that's an apple. So when you have a woman in front of you telling you, these are my symptoms, this is how I feel, and you don't know, sometimes the physician will either say, this is not your heart, this is not this is not that. So eventually a woman will stop talking because they now start thinking that this is on their heads. And then that silence is what I said, that silence that's gonna cost you your life. Because they stop talking, feel embarrassed, maybe it's me, it's in my head, and then they don't get the right answer.
When I was younger, I think you just tend to roll with whatever the doctor tells you to try it out because they are the physician. You trust them to make good decisions for you.
After having been to Dr. Alvarez, I have talked to a couple other different women that out on the golf course that had the same symptoms, and they were going to male cardiologists, and they were not getting anywhere.
You just have to be your own advocate and think about it. Okay, so if I don't feel good, I know that there must be something. And it doesn't necessarily have to be something catastrophic, but it's something that is limiting your quality of life. So the call to all the women that are watching this today is like, don't settle.
From a previous cardiologist, I was diagnosed with something else altogether after many, many tests, after many, many years. And I really didn't think it was correct. So I sought out Dr. Alvarez after hearing good things about her. And she ran tests, and right away, she knew what it was. All it took was the right test.
I actually went into second-degree renal failure because my doctors were not able to get my blood pressure under control because they weren't taking care of the heart problem.
Every day, women are going to the emergency room. They're going to their doctors expressing symptoms that are related to heart disease or a heart condition, and the doctors are not recognizing them. As Dr. Alvarez says, you have to be your own advocate.
We have to change the way we look at health. It's a present for you and for your family. If you're not healthy, you're not going to be 100% there for your parents, for your kids, for your spouse. And I know for sure that if there is something that you can give as a present to your family is your health. Because your kids will appreciate to have your mother for the holidays. Your spouse will appreciate to have a wife that is still there for that with them. And your parents would love to have their daughter still present. That's my goal. My goal is to, if you love your family, if you want to be there for them, then give yourself the gift of health. Anybody can develop heart disease. And so I guess that the importance here is to, as you recognize that there is something that is not right with you, don't never let age be the reason why, like, this cannot be my heart. Sometimes we as human beings do it on purpose because who wants to think about the most important organ, the heart, is the problem. Like, because this, again, is a life or death. It's like when we think about heart conditions, it's like, it's life or death. When we think about the prevention of heart disease and what does it need to be done, it's simple. It's very simple. It's trying to live an active life. If you keep your body moving, if you exercise, and I know that this sounds so tacky because we talk so much about this, but we cannot emphasize enough the importance of exercise for prevention of heart disease. The heart is a muscle, it requires activity. If you exercise, it helps you reduce blood pressure, help you maintain your weight. When we also think about lifestyle, we emphasize a lot diet. And I know that diet creates a very, very open, like a kind of worm when we think about diet, because even in our associations, there is not a consensus of what is the diet that we have to follow. Try to focus more on your nutrient-rich food, which is as natural as possible. There's people that have a good diet and they exercise and they still develop heart disease. So we know that the condition is more complex than that. So in addition to that, your doctor can run tests to get an understanding of what other things you might have that can put you at higher risk for heart disease. Now, that will require investment on your end. That will require investment on your end because we have to be willing to pay.
A good diet and exercise are a great way to prevent heart disease, heart attack, or a stroke, but genetics also play a part. And unfortunately, our healthcare system operates on a reactive approach, treating someone once they're sick, the Medicine 2.0 approach, instead of helping patients add life to their lives by using a preventative method.
One day, I hope you witness that people see doctors to preserve their health, not to try to recover their health. So today we practice the medicine like Dr. Peter Attia, we said medicine 2.0, where we are reacting to illness. So we wait until somebody's sick, and then now we are trying to do things to fix them, versus why we cannot do something to keep them healthy. When we're thinking about preventive care, if we keep practicing medicine 2.0, we cannot make things better. So that's the reason why I developed the program NITZAMD. So NITZAMD is a program designed to help women live life to their fullest. The motto is add life to your life, because today in the healthcare system, if we are looking into something that can help us understand where are we standing today so we can actually be more proactive or do whatever it takes to continue living healthy, there's no insurance that offers that. So I want to have that program out there so people can benefit from it, because I cannot keep practicing medicine with the status quo. The status quo is that the patients are going to come to me when they're sick, and it's already too late.
I definitely would say make sure you're taking care of yourself. My recommendation would definitely be make sure you're in tune with what's going on the first time you feel off. Maybe either get that checked or at least be aware of it and track it, write it down, kind of just have an awareness of when you don't feel like your normal self, to just stay ahead of it, stay ahead of, problem.
So when we buy a new vehicle, which we have gone in our life through so many vehicles, and this amazing vehicle that God gave us called our body is only one, and we do not get to buy another one. So why do we actually do take care of that car? Take it for checkups, maintenance, oil change, and check the brakes whenever we're gonna go on a trip, because we want to make sure that that car is working as its best, and anything that can potentially be problematic so we can address it. But we don't do the same thing with the body. We wait for the body to start aching. We wait for the body to start sending a signal that something is wrong, and at that moment maybe the engine is completely broken, and then it's gonna cost you more money, and that is if we are lucky that we can recover and restore that engine. I think that another reason why people do not focus a lot on health is because insurances don't cover preventive care. They don't cover a visit to the doctor just to make sure that you're okay. They will question, why is this test being ordered if you're not having symptoms? I chose cardiology because as I went through my rotations in medical school and realized that when patients have cardiovascular problems, is very intimidating for them. When somebody gets a diagnosis of heart disease, it's like a life or death situation. And for me, it was super valuable to not only be the expert that understands the disease and be able to help them recover their health and their life, but also to be able to offer them the comfort, like be a friend for them, but at the same time, be the specialist.
Join us next time when we'll be presenting specific topics that affect women in a different way than men, such as arrhythmias, heart failure, and heart attack. On behalf of Dr. Nitza Alvarez and all our brave and inspiring women you've seen during this episode, I'm Megan Clementi. Thank you for watching. We invite you to subscribe to the NITZAMD YouTube channel so you'll receive alerts when new episodes of this docuseries are posted. To see your potential risk level for cardiovascular disease, take a brief online quiz at NITZAMD.com. Heels vs. Ties, Living with Your Number One Threat is available on Amazon and Audible, or learn more at heelsversusties.com.